The University of East Anglia has been a world leader in climate change study for over 30 years. It's also home to Carbon Connections, which funds low-carbon innovation, and CRED, the Carbon Reduction Programme. Carbon Connections is funding a pioneering scheme, pairing third-year environmental sciences students with local organisations. The aim is to get them to work together to reduce carbon dioxide emissions. Student Alison Morris was teamed up with the Norfolk and Norwich University Hospital. Alison works directly for Serco FM. They employ the non-clinical hospital staff, such as cleaners and maintenance workers, and are responsible for the day-to-day operation of the large site. But in order to have an impact, Alison had to work in cooperation with Octagon Healthcare, who own the hospital buildings, and the Norfolk and Norwich University Hospital's NHS Foundation Trust, who are responsible for the medical side of the hospital. Altogether, there are over 6,000 employees on the site, so Alison was faced with a big challenge.
We have an energy bill of around about £2 million a year, so any effort that we can make to reduce our carbon footprint has an immediate knock-on effect in terms of saving pounds off that £2 million energy bill.
I think carbon reduction is going to be very, very important in the next few years with climate change, with lack of fossil fuels, with everything really, so it's essentially going to affect everything that everybody does in the next few years. So I think having some experience on how to do that, plus being able to explain to different people, getting to know, getting knowledge on everything is just going to be really helpful to everyone.
The building has 1,000 beds, and obviously that has all the associated power that you would expect, you know, heating, lighting. But what we also have is a whole host of specialist equipment, from simple things that you would see every day, like an X-ray machine, through to some very specialist MRI scanners, etc., that all have much higher power requirements than you would have at home or I would have at home.
The hospital was built recently to tough environmental standards and already had a carbon-reducing policy in place before Alison started work.
We do have a carbon management team which includes everyone from the 3 partners and also people from around the trust in the IT, the finance, the nursing. You know, everyone's kind of included in that, which has been very, very helpful for me at least, that there are just other people who are enthusiastic, people who have the right connections and know who to talk to about things to get them done.
Yes, we'd be doing the obvious things like the recycling of cardboard, recycling of paper, but it was then, well, what more could we do? And obviously energy was a key driver.
Reducing energy use on such a large site is complicated. Changing the behaviour and attitudes of the hospital staff is critical. Alison helped with this task of reducing power consumption by raising the awareness of the hospital employees. She held lunchtime workshops and special events to try and motivate people to change.
Such a large organisation containing thousands of people, they all manage their attitudes in different ways, and you can't single out one person and influence them. It has to be taken on a whole organisation approach.
I'm definitely hoping to make a difference, even if I've left by the time the difference actually happens. I think what I'm doing at the moment, and with the carbon management programme and with the project that's being run that I'm involved in as well with the UEA, I think that is going to make a difference. It's just how far down the line that it happens.
Alison was also involved in technological projects to reduce carbon emissions. The hospital's power plant already boasts efficient machinery, and so the challenge is to reduce the amount of power that's required whilst not compromising patient care. In the atrium area, new LED lights have been fitted.
This is the East Atrium. This has just gone through a redecoration programme, and what they've done as part of this is they've changed the lights, so they're now all LED versions. Early estimates suggest they're saving us about 14 tonnes of carbon and about £1,600 a year.
I guess the carbon savings are sort of an added benefit with this project.
The lights don't come on unless the lux drops below a certain level, and they're all done on photo sensors, so you won't see them on very often at all. It's just at night time really. I mean, it's a great idea that they've done,
and they are looking at it for other areas as well. Every time something new comes in, I always get an email, Alison, can you work out the carbon for this? Because obviously they are working towards a target, and it is a target that has been publicised.
In office environments, Alison trialled devices that helped make power saving easier and has helped advise on the purchase of new energy efficient computers. And new Mega Miser devices mean that these car park lights can run on slightly reduced voltage, with a potential saving of 25%.
So what these devices do is they sense when a light or something doesn't need as much power, and it just brings the wattage down a bit. And so that's going to save us, calculations show, about £7,000, about 53 tonnes of carbon a year.
Having a carbon connection student has helped the hospital develop and expand its carbon reduction policies, saving carbon and money.
It makes a huge difference to the people that work here, and the kind of the way people see the organisation. We're taking responsibility for this, and we're choosing to do something about it.